Today is the first day the youngest kids are able to roll up their sleeves for that COVID vaccine. Joining us to answer your questions is Dr. Helen Boucher, Interim Dean of Tufts University School of Medicine and an infectious disease specialist at Tufts Medical Center. Thanks for being with us, Dr. Boucher.
Great to see you, Erica.
Dr. Boucher, a recent Kaiser Health poll found that just 1 in 5 parents will get their littlest ones vaccinated immediately. How concerned are you about hesitancy with this age group?
You know, Ben, it is a concern, and I certainly don't blame parents. This data has been confusing, long awaited, but I think we all need to do everything we can now to provide parents with the best information they can have and really hope that they're talking to their pediatricians about what's best for their small kids.
We know the focus on authorizing shots for this age group was really safety more than effectiveness. What do we know about how much protection kids will have, particularly against variations of Omicron? We know the studies were really small.
Right, the studies were small, and they looked at antibody response, which is the way that we develop these vaccines in children. And what we saw was a very similar antibody response to what we see in adults. So that's good news, and really there's every reason to believe that the protection will be just as good in kids as adults, protection against severe disease and death from COVID. And there is some small number of people who developed COVID in these trials, and indeed fewer children who were vaccinated developed COVID than those who were not vaccinated. Of course, this was not the design of the study, so not statistically significant.
Well, of course, the big news this week, Dr. Boucher, is on the kids. But even with our numbers dropping here in the Northeast and in New England, there's still anxiety out there among some adults. We got this question from Maureen. She writes this: what is the COVID situation in Massachusetts now? Is someone who's wearing a KN95 mask among non-mask wearing people, say in the airport or on a plane, protected from COVID? We have seen our numbers drop, but are they dropping fast enough, Dr. Boucher?
Well, it's a great question. You know, there's still plenty of COVID around. I think one of the key messages is that deaths are at an almost all-time low in the epidemic, and that really tells us that a lot of people have immunity, whether it's immunity from vaccination, natural infection, or both. And seeing those death numbers stay low is a very good sign. On the question of the masks do protect the wearer. So if this person is wearing a mask on a plane or out in public, they are well protected. And I think it's a great idea to wear a mask, especially indoors when you're not sure of the status of the people with whom you're interacting.